Thank you very much. So in terms of risk assessment, whatever you do in terms of mental health referrals, assessments, risk assessment is going to be key. And I definitely think that seeing your risk assessment on referrals that you make would really help with being able to triage them appropriately, as well as streamlining your management, so you're not having to perhaps go back and collect aspects of information later on down the line. You've kind of done it all in one. And we've got here what's called a kind of three-dimensional risk assessment, where we try to look at risk into different domains that give us a 3D vision of what it is, and a structure of recording that so that it's comprehensive and so that you miss out as little as possible. So here we've got kind of past, present, and future. So we've got the kind of time-related domains. So past is based on the patient's history of presenting their history. So you might have some of this on your computer systems. This might be from their history of presenting complaint or past psychiatric aspects of their history. And I've also put aspects of their past medical history because that may impact on kind of how management is able to be instated, certain investigation or treatment of organic illnesses, and that might impact on what the current risk is. I mentioned kind of eating disorders. If someone's kind of been starving themselves, then the risk might be more in a context of that physical health aspect of stuff. So that's why I've included it within there. But their past risk, their present risk, and that's informed by the current presentation. So that is kind of history of presenting complaint, and history of presenting complaint, and understanding what some of the kind of triggering and complicating factors are, and we'll cover that, a bit of that, in aspects of the history taking that I'll move on to in due course. Their treatment concordance, and as we're going to cover, treatment is not just pharmacological, it is non-pharmacological. So what is their propensity to engage with and continue treatment, whether there's concurrent use of substances, alcohol, illicit substances, or mind-altering substances, high amounts of caffeine, coffee, that type of stuff, and if they're vulnerable persons who are involved, who living with that, with the client who you're assessing. So that present aspect of risk. Future risk. Now, we can't predict the future, and you're not meant to come out of this webinar able to predict the future. I can't give advice on clairvoyance, but what we can say is that the past can inform the future.